Happy Employee Appreciation Week. Hi, I'm Rick Barker. I'm director of the EEG department. The EEG techs here at Hurley, they're very knowledgeable, they work together as a team, and I truly love being part of that group.
Hello, I'm Michelle Gilmore. I'm the new nurse manager for ICCU and PCU. And what's really impressed me is I came into this department at the height of the pandemic, and I've just been really impressed with how the staff has embraced not only me, but the multiple changes, the high acuity patients, and they're just eager to learn more. But one of the few cases that really stood out to me were the times that during the periods of time that we had no visitors, I had staff staying after their 12-hour shift just to hold the hands of the patients that weren't doing as well. And to me, that's really what makes my unit special.
The Hurley operators are always here for you, 24 hours a day, 7 days a week. They answer and triage each call with a professional smile. They are a part of what makes Hurley stronger together. They are an awesome team.
Hi, I'm Kim. I'm the manager of the operating room, and I have an amazingly dedicated team who works nonstop to be the patient advocate and ensure the patient safety in the operating room. With us being a level 1 trauma center, it is so amazing to watch everybody jump in when that level 1 trauma comes up and make sure that patient has the best possible outcome. My team is wonderful and works hard every day for our patients, and I'm so proud to be part of the team for them.
I'm Barton Scotland, physician assistant, trauma surgery clinical coordinator, and I've been fortunate enough to be the person who's been asked to be the manager of an awesome team of mid-level practitioners of PAs and NPs who have given so much to this hospital and to the community, these patients that we see. The thing that makes my team the strongest, as I would say, number one, their dedication. They are so committed to doing a great job and taking care of our community and taking care of our patients. They will do anything to make sure right is done by their patients. Very, very passionate about that. The other thing that I continue to be moved by is the selflessness of most of the people, not only in my team, but also that work here. People are always sacrificing in one way or another, whatever it takes to get things done for the patients, and that's something that you don't see a lot of always in a lot of other organizations. I'm just inspired by them, thank you.
I'm so grateful for the entire senior leadership team. Each and every individual brings unique perspective, and that helps us to create better solutions in the long run. I know I speak for each and every senior leader when I say the true team that we are grateful to be a part of is the entire Hurley family. We are so fortunate to have so many devoted employees, and those employees are what makes Hurley an institution that we can all be very proud of.
Our pediatric intensive care unit often gives advice to our families and our parents that you have to take care of yourself before you can take care of your children. So we follow that same advice here, and we make sure we're taking care of ourselves so that we can better take care of the kids. The nurses have a script. Every hour of the day they have a different 1 to 2 minute exercise, and they'll, on the hour, whoever's available that's not participating in patient care at that time, they will stop and they will all do, say, 30-second wall sit or 15 squats. They're always encouraging each other, and I think it's a good fit for all of us.
Marketing is more than a group of happy, talented, fun people. We're an award-winning team that's always willing to go that extra mile for our stakeholders. We've figured out early on what it means to be a team, and I think that our biggest takeaway is always just being kind to one another. And I can't speak for everyone on the team, but for myself personally, I learned that when I joined Hurley a long time ago from Doug Pike. So I just like to say, when in doubt, be a Doug.
I think what makes my department special is that both of them charged right into this pandemic that we're having without any fears or questions. I'm sure they had fears, but they still went forward and did their jobs the best they could. and really good actually on both sides, where we had problems with PPEs, getting all that stuff, and had to manage that, and our guys were in those areas taking care of that. Our cleaning staff was amazing. Some of them were sequestered into units for 8 hours at a time, unable to leave, and no one fought back. Everybody did what they were supposed to do and did what they could do to save lives and not let this pandemic get any bigger than it already was. So I'm pretty proud of all of them. They did a great job.
I'm so proud of my operations team here at Hurley. They are the best group of people I could ever imagine working with. They all are so dedicated and pulled together, and we do everything we can and have each other's backs to make sure that we're caring for patients and serving our community.
I would just like to take a moment to highlight and sincerely appreciate Hurley's Care Coordination Department. Hurley's Care Coordination Department is made up of nurse case managers, social work case managers, navigators, and our vital office staff. Our nurse case managers and social workers work all over in every environment of the hospital, making sure that equipment and care is arranged for patients, that vulnerable patients are getting what they need in terms of resources and support, that detective work is being done to find the connections that patients need to have for them when they're stuck in a hospital setting. It's really, really incredible work that this team does. This team exemplifies Hurley Family Stronger Together. The work we do depends on the work you do, and vice versa. The work this team does cannot exist without an entire Hurley family team. Any goal we would have for a patient or plan we might arrange for a patient is completely dependent on every other team player playing their role in harmony.
Hi, my name is Amanda. I'd like to thank the Cath Lab, IR, and ECHO departments. Each team member brings a valuable asset to the team, and together they are able to save lives every day, and they work great, and I'd like to thank them.
My name is Mike Burnett, and I absolutely have the pleasure to oversee the foundation team. And when we think about the Hurley family being stronger, working together, I think the foundation exemplifies that in so many ways, but one of the ways is just the energy and the innovation and the creativity that comes out of that team. I honestly don't think there's a day that I come into the office where there aren't just new ideas coming from every facet. And remember, in this team, everybody has their thing that they're doing, but the ideas that flow from them are ideas that impact the entire foundation and are good for their team members and are designed to help their team members. And so that's one thing that strikes me is when you're working together and in the foundation, there's just so much energy and there's so much of a desire to reach across and lift everybody up, not just that individual person who had the idea. So it's probably one of the most rewarding things about that foundation is the energy, the collaboration, the innovation that comes out of there. Really pushes us forward, challenges the whole team to be better, and ultimately all of that works to further support the medical center, which is what we're all here for, the medical center and the patient. So that's my pleasure with working with the foundation team.
These last few months have really shown how the nurses have pulled together. I'm so proud to be one of the leaders of the nurses as they work so tirelessly in such a strange circumstance. They never knew what was coming at them, but they took it in stride. They worked together. They worked in unfamiliar floors. They worked in unfamiliar circumstances with people that they haven't worked together with before, but they did a great job. And that just shows that we can do it together as we work together as a team, and that we're always stronger together.
Hi, my name is Tarnisa Martin. I'm the nurse manager of 7 East, which is a medical surgical team. And I'm here for employee appreciation. I would like to say that I think that my team is unique because we have a family love. They always call me Mother Hen, but that's okay because I love following up with staff and patients and rounding and being a team player with them to show that they're supported. I think the diversity, the multiple patients that we receive on our unit, and how in a crisis we can all come together as one and work together as a team to provide care. I love working at Hurley. I've been at Hurley for 17 years and I've been a manager for 10. I've seen a lot of nurses come and go, and I've seen a lot of nurses stay. And I would just like to say I think that our team rock. and being that a rock is something that holds you together. A rock is something solid. And so I would like to say for Employee Appreciation 7 East, you rock.
Hi, I am Keisha Gates. I am the Assistant Nurse Manager of 7 East. And I just want to say I am proud to be a part of the Hurley team. I have been here for 18 years. I feel that on 7 East and throughout this medical center, we give our all despite of what's going on. And even through this pandemic, we're giving our all, trying to be the angels that we were meant to be to help everyone through this crisis. And as my mask says, it does not storm forever, and it doesn't. So we have to be positive and just pray through this crisis, and we will make it as a team.
For those of you that don't know me, my name is Melanie Krisnarich. I'm one of the physician assistants in the emergency department, but one of my responsibilities at the medical center is to also staff the ICU step down. And the coronavirus brought an amazing opportunity to our staff. We were taken by surprise in how the patient visits declined, but the acuity increased, and we saw a need for extra hands up in the ICU step down. And I was really proud and pleased of the number of ER providers that stepped up to go upstairs and help in the ICU step-down area.
What makes my biomed team special is they're always eager to help. Whether it's something small as replacing a battery or assuring a ventilator is safe to use or even training staff, my team is always there to help.
Our 6 East team, I would like to thank them for all their hard work. Whenever there's a difficult situation, they're always able to handle it, and they pulled together as a team. Our 5 West team, they were one of the first COVID containment units, and they went with the flow every day and were able to take care of those patients. Our rapid response team, they've had a lot of new tasks thrown at them throughout this year, and they've done a great job taking on all of those new tasks.
One of the ICU providers completely had a raw moment where they were just, they basically like broke down and became very emotional and were very sad to see otherwise healthy individuals come in and become so acutely ill. And I just remember she put her head down one day and she just said, "Melanie, I just need this person in this room to do well and to make it." And there were just, it was really something to see that. It clearly took a team effort from a lot of different angles, and a lot of people really just stepped in and helped out where they saw the need.
Well, I just want to take a moment here to say thanks for the department in finance here in the School of Nursing. We are a very good team. When things fall behind, you know, people pitch in, and the work is technical and sometimes monotonous, but we adhere to the accounting rules and make sure that people get paid on time, vendors get paid, cash is in the bank. We make sure that whatever revenue needs to be collected, that happens. And but also we do enjoy having a little fun. Pre-COVID, I used to blow the horn, and people would come out of the offices and basically do a 2 or 3 minute exercise in terms of squats. Birthdays get celebrated. We also used to have a competition in terms of information technology of an exercise program. So overall, you know, we have a good group of people.
Hello, Hurley Medical Center. I want to take this opportunity to introduce infection control and infectious disease. Infection control on this side, I have Rhonda, Tracy, Tony, myself, Ann, and then infectious disease, Dr. Osterhauser, Dr. Raffi, Dr. Eunice, and Dr. McDonald. So this is infection control, this is infectious disease. It is our jobs to do infection control and infectious disease. It's everyone's responsibility to do infection control and infectious disease. And we want to take this moment to thank the entire medical center for their response to COVID-19 and what every single one of you did during the pandemic and still what's to come. Hurley Medical Center was awesome at their response for COVID-19, and we cannot begin to thank each and every one of you enough.
What makes this Hurley team special? And I thought back and I thought of one example, and when I think of that example, it's the time when the hospital was tasked with coordinating a mobile drive-through testing station. And oh yeah, it was during some very miserable weather. Certain members of the team stepped right up and provided some unbridled support. They included the likes of the laboratory services, and I wrote down some names because I really didn't want to forget anybody. And under laboratory services was Mitch, Emily, Tom, Becky, Kim, Christina, Sam, Tara, Janice, April, and Christine. MAs, Amanda and Corrine and Alan from outpatient services under the direction of Olivia Wallace. And oh yeah, Olivia also provided some much appreciated hand warmers for that time. Dr. Tupper and the pediatric residents, additional support from Matt's public safety team, Pat Lear, Brian Nicholson, Mark Mobus, and facility staff, Joe Dennis and Gary Ireland. And certainly not to leave out the ever-patient hotline staff, Stephanie Leffler and Becky Looney. And they were patient team, and if you know Becky's husband, you'll understand why she's so patient. Sorry about that, Wayne. Collectively, this group, along with some others, pulled together and coordinated an amazing resource for this community in an unprecedented time of immense need. The breakfast sandwiches and lunch delivery as arranged by Jordan and the foundation was unnecessary but much appreciated frosting on the cake for this dedicated group of staff. I just wanted to say thank you to this team.
Hi, it's Kathy Metz, and I've been privileged to work at Hurley for many, many years. And right now I currently have responsibility for our outpatient therapy, mental health, wellness team, my HELP program, inpatient rehab, cardiac rehab, and the food pharmacy, and I am extremely blessed. In each of these areas, I have incredible leaders who make my job so easy. They're all dedicated to the mission and purpose at Hurley, and they all work tirelessly to make the patient experience wonderful.
Hello, my name is Yvonne Hernandez. I'm with the IT department. What makes our IT team special? I think we are a team of over 90 employees. Our team is really special because I have some of the things I could think of is we have the expertise, the character, and the drive to make us successful and sustain our success. Our teams are so passionate to make us successful and dedicated. It really helps influence our decisions in so many aspects to make Hurley better.
I'm Mike Joseph, Senior Director for Enterprise Infrastructure here at Hurley Medical Center. And 2020 was obviously met with some substantial and unique challenges with COVID, coronavirus, the pandemic this spring, and obviously still ongoing. And we were able to keep up with that demand. We were able to implement technology, existing technology, in kind of new and unique ways to adapt to some of the challenges with clinical exposure, with patient visitation, with the testing clinic that was put out at Atwood. We were able to, within the course of hours, set up a high-speed radio network, an extension of Hurley's network out to the Atwood Stadium COVID clinic, and put a rack in with wows and telephones and printers to make sure that we could still use our Epic workflows for the specimen collection and keep people safe and get the results turned around as quickly as possible. So a really outstanding job from all of our technical and Epic people and pretty much everybody from the whole department. That was really amazing.
Hello, I'm Stacy Doherty, Director of Ambulatory Clinical Operations in the IT department. Our IT team works together every day. They're dedicated, they are adaptable, resilient, they work together as a team. When one team struggles, the other teams pick up. I am proud to say that we make Hurley the true definition of Hurley family, and we are better together.
Hi, my name is Fonche Golden. I'm one of the supervisors for dietary, and what makes our team special is that we have a variety of experienced people that work in different areas of the kitchen, We all pulled together despite of the different changes that we were going through throughout the pandemic, and everyone pulled together and came together to make it work for the whole department throughout the hospital. And one of our goals is to always do what we can to make everybody visit and stay here as special and pleasant as possible.
Okay, I'd like to take a moment to recognize the ambulatory team here at Hurley. Our ambulatory team staff are strong, dedicated, responsible. They're flexible. They move around, pick up assignments wherever they're needed. They take ownership and responsibility, and in order to have a solid team, these are all values and qualities that are much needed in the ambulatory world. The folks on the front lines I'd like to give a shout out to in the urgent care and ONC health, who have had first responder responsibilities and recently unexpected increased volume that they have managed very well. Speaking to the team effort, everybody's pitched in and has done a fabulous job. The ambulatory team is stretched pretty thin. We have many off-sites that they go to or get pulled to, and everybody's willing to cover no matter what the service is. So go ambulatory team. Thank you for everything you do.
The pharmacy team at Hurley is an awesome group of pharmacists, technicians, that all come together to make sure that medications are being used safely for patients here at the medical center. They are a great group of people that work together every day for a kind of behind the scenes, and it's just an awesome group. I couldn't be more proud of them.
So when I think of a team, I think of a group of people working together with an objective, with a mission, with a goal. I think of a group of people that can adapt, that can change. They leave their egos aside, any behavioral issues are aside, and they work together for one objective. So in medical education, we have that team, from our coordinators, from our faculty, from everyone that's involved with medical education. And I think that a great example of this is when COVID hit. Medical education had to make some adjustments. They had made some adjustments on the fly. They had to change curriculum, and they had to get together and develop a new team to take care of our COVID patients. Education was still going on, but it was the residents and the faculty working together to make sure and meet one objective, and that was to save lives. From nurses, from techs, from pharmacy. It's all one team, and for that, I think that we should all be proud that we're a part of Hurley Medical Center.
Why do I think that our Child Life Specialist team is so special? To become a certified Child Life Specialist is not an easy feat. It takes a lot of training, a whole year of training that it goes unpaid. So you know when you come into this field that you have to want to truly want to work with children. That's your goal, that's your passion. But our team here at Hurley, they go so far above than what they have to do. Their compassion, their empathy, everything that they do shows in everything that they do for our families and our children. We had a patient he was battling cancer. And at the end of his treatment, his mother actually told someone else, she didn't even come and find me, this got through to me. Her words were, she was very grateful to Hurley Medical Center because the medical staff had saved her child's life, but that the Child Life Department had saved his spirit. And I think that is just the epitome of what a really great Child Life Department can do.
Hi, my name is Vince Waller. I'm a nurse manager of 9 East, the oncology and hematology unit here. I am new to the unit. I just want to say I appreciate all of you for the hard work you have done, for embracing me and taking care of our patients. They have nothing but good things to say about you. Thank you so much for all that you do.
Happy summer, everybody. I hope everybody's getting to enjoy some time off with their family and friends in the nice hot summer. I wanted to take my 20 seconds of fame here to make sure that I'm showing my appreciation for what all of you guys do out there. I want to start with the team that I work closely with, and that's the nurse managers, the house directors, and the nurse clinicians. And I want to thank you guys specifically for, one, having patience with me, but also for the hard work that you've done, particularly in the last 4 to 5 months with COVID. I know you guys do it every day, but the last 4 or 5 months has been really rough for you guys, and I appreciate all you've done. Secondly, I'd like to take some time to appreciate the people at the bedside, the nurses and the support staff at the bedside. Without you guys, nothing else happens. I am humbled by the care and compassion that you guys give on a daily basis. Again, you guys really stepped it up. We're very flexible during COVID, and I can't tell you how much that I appreciate that personally. I hope everybody has a good summer, and thank you for everything you do.
I wanted to give a quick shout out to the bariatric clinic staff who've managed to keep the clinic in operation with some variations in practice and maintained relative ease of access for their patients when those times of needs arose. Dr. Farhan sings the praises of the team over there.
The Hurley family is something special. It's amazing how everyone came together during this COVID crisis and just pulled out all stops and made this place just incredible. And I'm so proud to be a leader and a manager here. My team with Tina finding masks and finding gloves and just being right on the spot with this 8 West floor and distributing things just did a really great job. Amy, Natalie, Ann working hard on keeping up with all the abstractions that go on in quality and working really behind the scenes on unrecognized a lot of times. Just thank you for being really great employees. Paula coming in and working from home, working wherever, and making sure ortho stays on track. Really great team and quality. We extend outside of our department so much and count on so many people at Hurley to work together. I think I became a part of infection control for many months for COVID to appreciate everyone and really take advantage of each other and thanking each other at this time during our appreciation.
I'm Rick Barker. I'm the director of the respiratory therapy department. The unique thing about being a respiratory therapist is every day you come into work, you need to be prepared to take care of the sickest of patients. We're part of the trauma team, the cardiac arrest team, the transport team of any critical patient. You also need to be expected to take care of patients of all sizes, all the way down to Hurley's smallest patients. So it's a very unique, challenging, yet rewarding position to have.
Hello, my name is Kim Lipka. I am the nurse manager of the Neurotrauma Surgical Burn Unit and the 5 East Ortho Surgical Step Down Unit. Neurotrauma is a unit that is a beacon of light that reaches above and beyond each and every day. Their hard work and dedication does not go unnoticed. They are a family that works together and they love what they do. 5 East is kind of an extension of the Neurotrauma Surgical Burn Unit. 5 East has worked really hard with the transition from being a medical surg unit to a step-down unit, and with their hard work and dedication, they are doing a great job. I am very blessed and proud to be a part of both of these teams.
Yeah, I'm Brian Nicholson. I'm Director of Supply Chain, and this year has been challenging for our team in many ways, from the purchasing folks trying to get supplies to the warehouse staff adjusting how they had to operate in order to house additional supplies, and the mailroom staff just additional pressure from having to do things differently than they have in the past. It's especially proud for me because this was all done with great ability to make changes on the fly. No complaints, just, hey, what do we need to do to make sure the clinicians have what they need when they need it. So I'm very proud of the entire team, from the purchasing staff to the mailroom staff to the warehouse staff, for all they've done in the last year.
Hi, my name is Mike Maruli. I am the Senior Director of Revenue Cycle Services here at Hurley. And I wanted to extend a sincere thank you to all Hurley employees, but most importantly to the Revenue Cycle team. Our role is to collect the cash, bottom line. And I wanted to commend the Revenue Cycle team in particular for the role that they play in this endeavor. We have had extraordinary performance, positive performance over the last few years relative to our success at Revenue Cycle metrics, to the point that we've even surpassed many of the Epic hospitals around the country in terms of performance, and that's extraordinary considering the fact that we are a 45% Medicaid payer mix here in the city of Flint. And I'm particularly impressed and I'm particularly proud of the attitude and the approach that our staff take relative to serving that population. It is with compassion. It is sincerely an effort that has not gone unnoticed.
Hi, my name is Nikia Allen. I am the nurse manager for the Behavior Medicine Unit. My team is special due to the level of respect and trust we have for one another. Due to the unique population whom we serve, we solely rely on teamwork and close collaboration as we face daily challenges. Together, we are Hurley Strong.
I'm Mitra Tiwari. I'm over the laboratory and sterile processing. I want to talk about what makes my team special. For the laboratory, I think their dedication, expertise, and teamwork make them stand out. We went right from a 2-year IT project, the Epic Beaker project, right into the COVID-19 pandemic. And I was confident that the staff would be able to handle everything with no problems. Just that level of confidence in their abilities makes them stand out to me. With sterile processing, I've only been over the department a little over a year now, maybe about a year and a half, and I've implemented a lot of changes in that department, and I would have to say I really appreciate their open-mindedness and willingness to improve. All the changes that have been made for the betterment of patients, and they have come with me along the way and they've supported it. So I really appreciate that as well.
I am Nor Birchmeyer, Director of Facilities and Support Services at Hurley Medical Center. I'd like to talk a little bit about the facilities management team. It is truly a team of about 35 staff members, divided up into 8 sections of people. So we have painters, electricians, carpenters, maintenance, and so on. Within those 35 people are 23 different job descriptions. So what impresses me and what I think makes them special is I think that no matter the job description, no matter what the issue is, they'll all chip in as a team, come together and make sure the issue is resolved, whether that be a flood, electrical outage, perform preventive maintenance, or just routine work orders. They don't get caught up in the whose job it is and those type of things, but they'll just do whatever is needed to get the job done, and I think that's what makes them special to some extent. I realize that's kind of a Hurley trait, but it also just allows them to be more of a family, and it creates a family atmosphere with them. And I'm very proud of that, and I'd like to take this opportunity to thank all the Hurley employees for what they do, and that we very much appreciate them.
I would love to thank my inpatient rehab team. We are so blessed to have great leaders in that department. We saw a really special situation during the COVID times where we converted half of the unit to taking care of COVID rehabilitation. We were one of the first hospitals in the region to do so. So the nurse leaders, Jill, Stephanie, Tana, Renee, Josh, and all of their teams just really shined for Hurley during one of the most traumatic times that the community's felt. I'm really blessed to be able to lead the outpatient therapy team. That's the team I grew up in, and we really, really have some great leaders there, and Julie, Angie, and Tina, working hard during the COVID times to bring business back, but provide the essential care that patients needed during this difficult time. My mental health team is phenomenal, especially during the COVID crisis when that service was needed so desperately. Phyllis and Rhonda, great leaders with a great team. We actually exceeded budget by switching everything over to a virtual platform, and I couldn't be more proud of that department. You know, sometimes they're forgotten because they're on the Linden, Rhode Island, but they really work hard for Hurley and Hurley's patients. I am really proud to be able to work with my cardiac rehab team. Jordan and Nicole, rock stars, patients love them, and now that we know that cardiac complications are a really difficult thing to manage during COVID times, we are so grateful for their knowledge and expertise. In my geriatric service line, I'm blessed to have Ruba Alcatab, who does a fabulous job with our hospital elder life program, and then Sammy Nottingham, who comes in every Wednesday and takes care of the hair for our elderly and makes them feel so special.
Hello there, my name is Tyree Walker and I'm the Vice President of Human Resources. And I just want to say that we're 13 strong in HR. We have a very strong, dedicated HR staff that are here to serve you and work behind the scenes to make sure that your benefits are in place, that we're recruiting good staff, that we're working with you on any employee advocate issues. I just want to give a shout out to my team, who's an excellent HR team. They're very dedicated. They worked hard during this whole COVID situation. They all came in to work and worked very diligently in making sure we're providing the support to all the employees, all the 2,700 great employees at Hurley Medical Center. And I've been in HR for 38 years, and this is one of the best teams I've been around, and it's a joy and pleasure to work with this team. They just do an outstanding job, and I'm proud of them every single day.
One of the other hats I wear at Hurley is I oversee the service line development department. And like other areas of the hospital, the service line is a small group of very talented people. Service line development is about growing the hospital. It's about keeping us relevant in this community. It's about finding more business. So every time there's a new piece of equipment that we need, or even a new doctor in a new specialty, or maybe it's a new office, that's what service line does. Service line are the group of people that have sort of their hands on the steering wheel. So anywhere the hospital needs to go, it's the service line people that sort of get us there. They're part clinicians, they're part business development people, part administrator, and again, they're a very talented group of people, many of whom have been around the hospital for a long time. So it's an impressive group to watch. I always sort of think of them, the service line group, as the tip of the spear of Hurley, right? We're forging through, and we're trying to be competitive, but more importantly, we're trying to find ways to service our patients. And I'm fortunate to be able to work with them, and hopefully you see the results of what we've done over the years with Hurley, that we've really risen to the top in this community, and I think we are thought of very well, in large part because of the work of the service line people.
The radiology department is truly the eyes into the patient that helps diagnose and properly treat the patient. When I think of Hurley Stronger Together, I think of the radiology department as the COVID-19 pandemic not only impacted our department physically, with the high volumes of x-rays that needed done and different imaging, but it also impacted us emotionally as we lost one of our own team members to the COVID-19 virus. The department came together, lifted each other up, and it was an honor to be a part of this team.
I had a family whose father was admitted to 5 East. They raved about the care that their father received, and they were amazed at the effort the staff put out to make sure that their communication was connected. The staff on a nightly basis would FaceTime their dad with them, and it was kind of their impression and really their only, what they would call, quote unquote, connection to their dad. I've had several calls from this family, from friends of this family, who couldn't understate or overstate the significance of what Hurley meant to them in such a critical time and during such a unique time where they couldn't be at their father's side.
So my name's Yvonne. I am the nurse manager for the GI lab, pre-admission testing, the recovery room, and same-day surgery. So hi everyone, and I just want to let everybody know how great my teams are. My teams do an excellent job getting patients ready for surgery, making sure everybody has their instructions, and that includes their families. They do an excellent job making sure that the patients have their fears eased and everything they need before, during, and after surgery. The customer service in all of my departments is second to none, and I'm very proud of my teams.
Our Hurley team is incredibly special. This hospital is special. Anywhere you go and hear other people that aren't from here talk about Hurley Medical Center, it's always with this degree of awe and reverence.
Hurley family, stronger together.
Hurley strong.
Stronger together.
Hurley family, stronger together.